Hey, this is Prepper Action, and this is a video that I pretty much never thought I was going to do. It was way on the back burner, on simmer, and now it's come to a boil. And what that is dental pain. It's not glamorous, it's not adventurous, it's not survival worthy, but it is if you want to survive. That being said, right now, if you have dental work to be done, I would get it done. And I would get it done soon. Sooner rather than later. Because when the you-know-what hits the fan, there's going to be very few options for dentistry. We may be looking at home dentistry or something to that effect. What I want to go over is some of the things you can do in a situation if you have dental pain. Now, the reason why I'm bringing up this topic is because I had just had all my dental work completed 6 or 9 months ago. And I thought, oh, I'm in the clear. I'm good to go for years. You know, no cavities, nothing going on. Root canal is already completed. And I was good to go. And then last night, tooth pain. On a scale of 1 to 10, it was probably about a 3. I took an ibuprofen, went to bed. Next morning, that pain was shot up to about a 5. Currently, it's back down to a 3, and that's thankfully because of a Vicodin. Yeah, it's painful. I don't know what it is. It's a former root canal. Gum is bleeding. It's sensitive to the touch. I can't chew anything. I've been having soup, and I'll probably have soup till I see the dentist on Friday. The issue is, during good times, we can have something like this fixed in a couple days. In the bad times, you might be on your own. You might have dental pain, and I know if you're like me, I get cranky when I'm in pain. I'm uncooperative and I'm grumpy. That being said, I'm going to go over some of the things you can do over-the-counter pain relievers. The ibuprofens, the kind that are non-steroidal anti-inflammatory drugs, which they call NSAIDs for short. Not only are they a pain reliever, they also reduce inflammation. The kinds that you don't want to really go to, but your next best is aspirins, like acetaminophen, Tylenol, aspirin, that kind of thing. Those are just pain relievers. They won't do anything about anti-inflammatory. The next could be something like your over-the-counter dental anesthetic gels, paste or liquids such as Ambisol, Oragel, Dentex stick, maximum strength. I would go for 20% benzocaine. And that you can rub on the gum line and it'll seep into that affected tooth. If you have ibuprofen or Vicodin or codeine stored in your pain reliever meds, that's going to be a good thing also. And let's move on to a more serious case, which is potential infection or abscess. That's when you do want to see a doctor or dentist, but if there's no dentist or doctor around, you may need antibiotics. If you have those, get on a regimen, take whatever you can 3 times a day or 4 times a day to prevent the infection from getting worse and spreading. Antibiotics will kill the bacteria that are causing the swelling, tissue damage, and infection, and they'll help relieve the pain as well until you can get that cavity or abscess taken care of. It may be a while. There are do-it-yourself kits if it's not that bad. There's a DentaNurse kit, which looks like a lot of fun to do. But you can get kits that will fix a damaged veneer or a damaged crown. Stay away from super gluing anything in your mouth, please. I've heard of people doing this, and it doesn't work well for them. It is not something you want to do. There's a temporary cement for lost crowns. If a crown comes off, it's called Dentatec Thin Set. It's a denture adhesive, much like Fixodent, and it can hold the crown in place temporarily. If you've lost a crown, you can also use these kits that will create a cement bond. You want to definitely clean that tooth up as much as possible. Depending on your situation, in a bug out situation, you may just be in pain for a while. But some of the things you can get are, your 20% benzocaine. That'll help relieve some pain. The thin set cap and crown cement, that could work for a temporary fix. Do-it-yourself dentistry is not something I would recommend, but in a you-know-what-hits-the-fan situation, you will have to do what you have to do. In an extreme case, it may come down to having that tooth pulled, and that's the mid-1850s technology of dentistry. Basically have a fifth of nice Kentucky bourbon, and when you're all nice and loose, somebody pulls that tooth out with pliers. It's not going to be fun. It's not going to be a good time, and you're going to be risking infection on that. That's something I'm not going to cover in this video, because I personally would not want to have that done to me. If it came down to it, you could do it. How could you pull your own teeth? I couldn't. Somebody else would have to do it for me. Anyway, in conclusion on this video, I'm going to include a PDF file that's I think it's about 240 pages long. Covers what you can do at home or anywhere for that matter for teeth and keeping them healthy, especially after a situation where you could be in a disaster or a you-know-what-hits-the-fan situation. So I'll include a link down at the comment section or near the bottom of the description of this video. I would say the best thing is prevention. Keep your teeth clean, see your dentist regularly now while you still can, while there are dentists. Get yourself a water pick, which is a good device. Even after hits the fan, you can still run it on your generator. Keep your teeth clean. Keeping them healthy is probably going to be one of the best things you can do. You may have your bug out bag, all your food stores, your water purification and filtering down, but unexpected tooth pain is not going to be fun. Trust me. Just trust me on that. That being said, click like, subscribe, comment, and be well. Be safe.